Welcome everyone to the Global University Climate Forum. My name is Michelle Brown. I work at the University of Edinburgh in Scotland, and I'm the facilitator for the session today. Before we begin, I'd like to read the statement of respect, diversity, and inclusion, which the organizers of the forum wanted to make sure that we highlighted. The Global University Climate Forum brings students together to share ideas, learn, connect, and act on the global imperative of addressing climate change. These are the forum principles of respect and inclusion. Be inclusive. Strive to ensure that all feel welcome and valued. This applies to our speakers and guests, as well as our student participants. Be open. Consider ideas that challenge your beliefs. If we support and learn from one another in this diverse group, we each become stronger. Listen honestly. The forum is a neutral and safe space for testing ideas and asking questions. Work to receive rather than react. And act mindfully. Bring the values of respect, inclusiveness, and humbleness into your actions as a climate activist. In the spirit of respect, inclusiveness, and humbleness, the organizers of the forum acknowledge that in many cases, today's society is built on a foundation of oppression, whether it has been through forced occupancy of land or through the subjugation of people. There currently exist deep and seemingly incurable injustices throughout the world. The organizers of the forum ask that all participants consider their role in advancing a new future and putting us on a pathway to right these wrongs. I am delighted to welcome so many students from around the world to this session on climate change, global anti-Blackness and implications for health. It is my honor to introduce our speaker for this session, Max Jordan Ngumeni-Tiako, and Max is going to correct me on my pronunciation. Max is a fourth-year medical student at the Yale School of Medicine. He grew up in Cameroon. He moved to the US when he was 16. He's earned a Bachelor of Science in Civil and Environmental Engineering from Howard University and a Master's in Bioengineering from the Georgia Institute of Technology. And he's now a medical student at Yale. His research interests include cardiovascular health, addiction medicine, and the built environment's impact on health. He's written extensively, he's widely published, a thinker, a change maker, and a doer. I'm going to hand over to Max Jordan in a second. Following Max's presentation, we're going to break into Q&A. Students, please add any questions to the Q&A function and we'll pick these up in the discussion. A very warm welcome, Max Jordan. It's an absolute honor to have you. We're delighted you're here and looking forward to your presentation.
Thank you so much for having me. It's an honor to be here with you all. Can I share screen yet?
Yeah, go ahead.
Okay. 1 second. Sorry about that. Where are we? Sorry, I'm struggling with the tech. Let's see. Okay.
Okay, just where you're setting that up, students are just introducing themselves to each other on the chat too. There we go, you're up.
Okay, I'm gonna go. Okay. Okay, so hello everyone. My name, sorry, my computer just fell. My name is Max. As Michelle said, I am in my final year of medical school, and I've had an interest in environmental issues for as long as I've basically been a student here in the United States, in part having studied civil and environmental engineering. So I start with a little bit of what will be like recent background. So I go to Yale now, but I spent the last year actually in Philadelphia in Pennsylvania. If you've watched the Fresh Prince of Bel-Air, I lived in West Philly, like the Fresh Prince. And it was really interesting living in West Philly, especially in, during the lockdown with the COVID-19 pandemic, because of course, everyone was for the most part inside. And so what you see here is, this is West Philadelphia, and the green is basically tree canopy cover in West Philly. And this red dot is a 50-meter radius circle around where I lived in Philly. So this is Chestnut Street. I lived on Chestnut, and I used to, I was always upset at the fact that if you notice, there are almost no trees on Chestnut. And when it was really hot during the summer, middle of the lockdown. I don't have a balcony. Um, it felt incredibly hot in my apartment, and I would want to go, sit on the porch at least, get some fresh air. With COVID precautions, being outdoors is recommended, but it was also really hot on my block. Right, there are like literally, as you can tell, there are very few green dots here compared to all the other parts of like, say, like Locust Street here, where there's lots of green. um, and it was a huge frustration. And that's one of the many ways I feel like we experience um, environmental apartheid. West Philly is a disproportionately Black part of town, and especially this like strip of like Chestnut, Walnut, and Market Street. And so that's sort of part of the inspiration for today's presentation. And so why do I want to start with Philadelphia beyond the fact that I happen to live there for the past year? Philly was also the bed of where I conducted my research. And interestingly, or maybe not, for some of you are more familiar, but Philadelphia is the poorest big city in the United States, with the poverty rate of 23%. Um, it's also the city with the greatest proportion of Black residents. Around 42% of Philadelphians are Black. And uh, these two things are not, separated. They're very much interrelated. The poverty rate in Philadelphia is the result of long-standing issues related to, racist policies, segregation, and whatnot. Um, and when I think about people's health, despite the sort of like level of poverty in the city, Philly is also home to some of the greatest, healthcare institutions that deliver very advanced, sophisticated care. So University of Pennsylvania um, is in Philadelphia, of course, and so their healthcare system is a phenomenal health system. And the Children's Hospital of Philadelphia is known for being one of the best children's hospitals in the country. But it sort of shows, this interesting dichotomy where there is tremendous quality healthcare. I mean, these are just two that I mentioned, but there's Temple University, Jefferson. There's several great healthcare institutions in Philadelphia, but the level of poverty really undermines the degree to which people are able to take great advantage of what is present in terms of healthcare to sort of optimize their health and live their healthiest lives. So that's why I find Philadelphia particularly interesting as a sort of like launching pad for this discussion. So I'm going to go back to talking about greenness, the tree canopy stuff, because that really affected me when I lived on Chestnut for the last year or so. So some of you may be familiar with this concept called redlining. Redlining is basically it's a historical government-sanctioned racial residential segregation, which has had really long-lasting consequences on housing policy in the U.S., poverty, and especially the racial wealth gap in this country. And so this is how it works. HOLC is what it's called. The homeowners loan corporation would grade neighborhoods based on what they considered hazardous, declining, desirable, and best. And this was very racialized. So, majority Black neighborhoods were considered hazardous, whereas majority white neighborhoods were considered best. And the reason why this is called redlining is because the HOLC maps would use red for what they considered hazardous neighborhoods. And so if you look at the redlining map of Philadelphia from the 1930s and 1940s, and you also look at the distribution of tree canopy cover in the city, you notice that the neighborhoods that were considered hazardous back then are also the neighborhoods with the lowest amount of tree canopy cover, very, 0 to 10%, like where I lived on Chestnut Street, versus the neighborhoods that were considered either best or still desirable have, they're pretty green, right? And that makes you think, what's happened, right, in terms of, investment, beautification efforts, like what has led or what has continued to shape the landscape in Philadelphia when you think about just the distribution of tree canopy cover. And if you pick any, maybe not any, but if you pick many large cities in the United States, you would probably be able to sort of like replicate this kind of juxtaposition. And why does this matter? So, in Philadelphia, greenness has been associated to people's health in different ways. So for instance, Philly has a very interesting landscape when you think about housing occupation. So to many people's surprise, there are more vacant homes. There's so many vacant homes in Philadelphia such that there are basically more people in Philly. I mean, there are more homes than there are people. There are many vacant lots. And so there was an initiative that led to mass like citywide vacant lot greening, because a lot of these lots that are vacant, they're kind of empty and dingy, and it's not beautiful. It's not nice to live near such, kind of depraved areas. So they greened many vacant lots. And what was found afterwards was that, one, there was a significant reduction of crime, including violent crime. After these lots were greened across the city, people felt safer, such that, one, there's, while crime went down by only 13%, people perceived that crime had gone down by much more, over twice as much. They had fewer safety concerns. From the same vacant lots, they found that residents also felt less stressed and had better mental health outcomes. And then from a sort of like experimental design perspective, this is actually work done by my research mentor. They took people on walks around the city and sort of like compare people who walked near recently greened lots versus people who walked near empty, kind of ugly or depraved lots. And they noticed that for people who walked near these nice and green green lots, there was a significant decrease in heart rate. So it's like, being by the park and feeling calmer and your heart sort of like slowing down a little bit. And that is quite literally a physiological response to stress or de-stress. Also, in the study that I led for this past year, we found that greater tree canopy cover was associated with lower odds of hypertensive disorders of pregnancy, so gestational hypertension, preeclampsia. And lastly, the last one I'm going to make about greenness and health in Philadelphia. So as a citywide, the city has this goal of reaching like citywide 30% tree canopy cover. And if we look back at the map here, it's only like a tiny corner of the city that has 30% or more of tree canopy cover. And so Philadelphia wants to get to everyone having at least 30% tree canopy cover within, in their neighborhood. And that the goal is to reach that by 2035. And interestingly, what they found in, some of these simulations, given how tree canopy is associated with worse health outcome, is that if the city reaches that goal by 2035, they could reduce the number of preventable deaths by about 400 per year, especially in low-income neighborhoods, right? Really telling. And of course, there's this association between what's a low-income neighborhood and like predominantly Black neighborhood. Okay, so how do we think about how greenness relates to health, right? So greenness, tree canopy have been associated with health and social welfare outcomes, right, across different settings, like beyond, not just Philadelphia, right? And many environmental exposures that are also related to greenness are sort of distributed in many urban settings in racialized patterns based on where people live, again, because of this history of redlining. And so if you think about how trees are helpful, so one of the many ways is that, right, tree leaves help filter particle matters in the air that we breathe, which, air pollution is bad for our health in different many ways. Trees also help with noise pollution and noise perception. So, if you live in an area where there are far more trees, you're less likely to hear the sound of cars, and the general noise disturbance that comes with traffic. And by the way, like Black people in this country tend to be more likely to live near major roadways. Trees are also good when you think about ambient temperature and humidity. As I mentioned earlier at the beginning of my talk, like I felt like it was so hot in my apartment and on my street. And I personally attributed that to the fact that there were no trees to provide shade. And it's been shown, right? I mean, if you walk down the street that has more trees versus not, you can quite literally feel that. But another thing that, unrelated to these, like, and to these ways in which trees are environmental buffers, is that trees, the presence of trees allow people or contribute to people feeling like they can exercise down a block, right? And that's also kind of related to the temperature piece, right? If it's really hot on the street, you maybe not want to go for a run there versus like if it's a little less hot. Like when I go for a jog, the stretches where there's a lot more shade, just my run feels a lot better. Trees and parks allow for people to congregate and create social connection, which in itself is a significant form of stress reduction. And so all of these things basically end up shaping different, a wide range of health outcomes. So when I think about environmental racism in the United States generally, and these different patterns, we already mentioned Philadelphia, but also want to think about how things have gone over time. So there's a study that was published a few years ago that showed that over the last decade, there has been a significant decrease in greenness, so tree canopy and other forms of greenness in urban census tracts that have more racial and ethnic minority residents and low-income residents. So not only was there already this like long history of like redlining, like from the beginning, but over time, in terms of upkeep, right, does the city continue to invest in maintaining or planting new trees or more trees in these neighborhoods? It's actually gone down. So little concerning, right? What I also saw is that there's been an increase in greenness in urban census tracts with more white residents during the same period. Now, and specifically in some settings, like Philadelphia is one of the cities where, for instance, how old the houses are in the census tract, it's actually a predictor of lower tree canopy cover. So like census tracts where the homes are way older. So if if there's been fewer sort of like beautification efforts or renovation efforts, then they're also less likely to have trees and greenness. Redlining has also been associated with significant differences in temperature by census tract, up to 7 degrees, and this is in Celsius. And the national average basically between census tracts that were redlined and census tracts that were not redlined is on average 2.6 degrees. And while tree canopy does help as a buffer against ambient temperature, that's not the only explanation as to why there is a temperature difference. Some housing policies also contribute to this. So for instance, the color of the roofs in a neighborhood, right? Like the color black, for instance, attracts more, this is physics, right? Attracts more heat. And so people have looked at black roofs in some parts of the town versus parts of town where perhaps a city and housing policies have evolved, or they're just building newer homes where they're no longer painting the roof black, and that has also an effect on ambient temperature in those neighborhoods. And then we think about air pollution generally. So there's been evidence that in the US, generally, Black and Hispanic people are exposed to significantly greater pollution in different forms from air and water pollution than white people. But interestingly, in the US also, white people contribute to pollution at a much greater rate compared to Black and Hispanic people. And this graph is an illustration of this phenomenon. And so this has a huge impact on multiple health outcomes. So for instance, many pregnancy outcomes have been associated with pollution, air pollution, greater ambient temperature, low greenness, they've all been associated with, for instance, preterm birth, low birth weight. These are hypertensive disorders of pregnancy. And I want to highlight especially how this relates to health disparities. Preterm birth in the United States, it disproportionately affects Black women, and it is a leading cause of infant mortality. So twice as many Black babies do not make it to their first birthday compared to white babies, and preterm birth itself is a contributor to that. So if you think about how the environment affects, one woman's likelihood of having a term infant versus preterm infant, and this sort of like compounding with all the other factors that are at play, and the ultimate impact on infants' health, this is really a huge issue in terms of these health disparities. When then we think about, for instance, teenagers, we know that it's been shown that redlining is associated with greater rates of emergency department visits for asthma exacerbation. This is a study that was done in California. They looked at 8 different cities. And by the way, asthma and asthma exacerbations are leading causes or sort of like greater contributors of healthcare dollar expenditures, especially among Black and Hispanic children and teenagers. And then also low greenness has generally been associated with a wide range of adverse cardiovascular outcomes, hypertension, stroke. I could name several, but just gonna stop there. Now, interestingly, or unfortunately, these collide with the healthcare system in terms of access and the quality of care that people receive. So you may know that in the United States, Black and Hispanic people have lower health insurance rates. They're more likely to be insured under Medicaid. Medicaid is the insurance plan that insures mostly low income or under/unemployed individuals. And the Medicaid reimburses hospitals at lower rates, and that has an impact on, for instance, certain hospitals' willingness to accept Medicaid plans because of these differences in reimbursement rates. The other thing is that Black and Hispanic people have longer travel times to hospitals. This is in part due to urban hospital closures over time. Over these past decades, there've been sort of like it's been like a series of urban hospital closures. Also, there is this element of hospital segregation that dates back to pre-1960s when Black physicians became more integrated in U.S. hospitals that contribute to worse healthcare outcomes, and it's actually been seen during the COVID-19 pandemic. So, for instance, if you look at New York City, community/public hospitals are more likely to care for Black and Brown residents, whereas large academic medical centers care for greater proportions of white residents. And when recently with COVID, people looked at outcomes across these hospitals. These community hospitals have had worse outcomes with COVID mortality compared to the large academic medical centers. But then you look at funding of these hospitals, and unfortunately, oftentimes reimbursement rates and funding and penalties are tied to hospital outcomes, especially with the Affordable Care Act, which it's kind of an unforced error there. But the aid that hospitals were able to receive as a result of how much they lost during COVID-19 disproportionately helped or rewarded hospitals that are already sort of doing well financially compared to the hospitals that disproportionately take care of low-income Black and Hispanic residents, which further sort of like widens this gap. And then even within hospitals, hospitals kind of manage to segregate care, among its patient populations. So, for instance, trainees, so people like me, medical students, residents, are more likely to see patients who are underinsured, low-income patients of color, compared to, for instance, some of our supervising providers who also have their private practices. So there's this, confluence or collision between the environmental factors that shape our health, but also the quality of health that people receive that ultimately lead to overall really significantly worse like long-term health outcomes for especially Black people in the United States. I'm going to pause here because the next part of, well, actually, maybe not quite. So I'm going to take a pivot. So I just talked about environment in the United States, and I want to talk about my own background. So I grew up in Cameroon. I was born and raised there, and I moved here when I was 16. And another element of why I am sort of interested in environment and climate is that Cameroon has a very diverse climate, like across the country. We have it all, one could say it sort of ranges from like tropical rainforest to like almost desert far north. And so just learning geography in school has fascinated me from that perspective. And so we're going to share some of the impacts that climate change has had on the African continent overall. So there have been obviously, worldwide severe changes in weather patterns over time, which has led to, lots of flooding. And within a continent, these floods have led to hundreds of millions of economic loss. And also hundreds of thousands of people have been displaced because of some of these floods. But in parallel, there are also droughts in parts of the continent that are rather on the drier side. And that all of this has had an impact on water supply and just the nature of our bodies of water. And so one thing that's really interesting is that a lot of our, we produce power from natural bodies of water, so hydroelectric form, sources of electricity. And so with the changes in temperature and that have contributed to water movement, there have been issues related to production of power. And the other thing in terms of water supply is that climate change has led to a significant decrease in clean water access. So for instance, in Nigeria, nearly 50% of the entire country's population does not have access to clean water. There's also obviously been a significant impact on agriculture and food systems. And for a lot of African countries like Cameroon, agriculture is a mainstay of the economy. And so, in decreased rainfall, which has significantly shifted many of these countries' agricultural output, is one of the ways that climate change has generally affected the continent's populations. And then I want to think about, direct sort of impact on human health. So the heat stress, which is associated with the aforementioned health outcomes. There's been obviously worsening of air quality and significant impact on agriculture, food systems. And one of the things that I think we don't necessarily often think about is the impact on the spread of disease. So there are some climate sensitive diseases that are fairly prevalent and not only non-communicable diseases, but also communicable diseases like malaria and dengue fever. So the environmental changes create sort of like niduses in favor of further reproduction of say mosquitoes, tsetse flies that obviously are vectors for some of these communicable diseases. The changes on agricultural systems and food systems further worsen the issue related, further worsen issues related to hunger, which is at baseline was already a huge issue on the continent when we think about malnutrition. And then in terms of impact on shelter, I mentioned flooding and displacement of people earlier. And, we'll talk more about vulnerable populations later, but I want to stop to sort of think about Q&A for now.
Max, thank you so much for your thought-provoking and inspiring presentation. Your research has really highlighted links between environmental issues, green spaces, climate change, systemic racism. I'm sitting in the UK, and research here has also found that people from Black, Asian, minority ethnic communities are disproportionately impacted by climate change. And as you just highlighted, we know around the world, those least responsible for climate change are feeling the biggest impacts.
Mm-hmm.
Of course, I'm sitting here as a white, middle-aged, middle-class female with all the benefits that brings. But I want to ask about the policy-making perspective as well. Nick Annam, a researcher at University College London, has written about a diversity deficit syndrome, and that challenges environmental groups' campaigns at various scales, and says from the global to the local, they fail to attract representation from minority demographics. And I think here in the UK, we've got groups like the Black Environmental Network and Climate Reframe working to amplify BAME voices. And I want to ask you, and this links to a question that's come up, what do you think needs to happen to eliminate systemic racism in environmental policy and in climate policy? And Josephine has asked, maybe then taking that down to a micro example from your case study, can it be a problem that urban areas become greener and more attractive, which then increases real estate prices, which might push low-income people away from those places? So maybe two questions for you, one from a kind of macro and policy context, and then taking us back to your case study.
Yeah, that's a really good question. This is something that has come up a lot. So this concept of gentrification, I think, is what she's hinting at the micro level when you look at a city. And I think, and Black people here in the US, right, have had this conversation long. And, before I lived in Philadelphia, I went to college in Washington, DC, which has gotten more and more gentrified over time. So every time I've gone back to DC, I run into fewer and fewer Black people, and DC coincidentally also happens to be a little greener, a little fancier. So it is true that as you beautify places, there's this shift, economic shift in real estate costs and whatnot. But I think there are forces at play here. Typically, what actually tends to happen is, as far as I've seen, is that it's more so that people move in first. So, like in DC, for instance, there was this long history, even across the country, of white flight, right, where white people fled the city and moved to the suburbs, right? But then now the concept, or I guess how gentrification is taking place, is rather you have younger, maybe recent college grads, like people who move into the city for their like first job after college, who are potentially more likely to move into what people call up and coming, a little rougher areas, because it's cheaper to live there. Now, there's a phenomenon where when white people start moving into neighborhoods, they make demands of the city that actually are listened to in ways that when the Black residents may have been asking for the same things, they were never listened to. And so, for instance, you have an influx of white residents in a neighborhood or in a community that now want to change. So this happened literally in Columbia Heights in Washington, DC, where I've lived. Same with LaDroit Park, where more and more white people move in. They're part of the neighborhood association. They want to change like a park that they thought isn't used nearly as much into a dog park. And they make the demand. The city actually listens, and then they change this park that was just a playground into a dog park because like everyone moves in with their dog. Or we need more trees. Like, I think the phenomenon isn't always that greening happens first and then people move in, as opposed to people move in, or there's like this slow trickle, and they make greater demands of the city that are more likely to be listened to. So, and there is evidence that policymakers listen to the demands of white residents and white voters more, even when they want the same thing as Black residents. And this is regardless of whether, for instance, you have a majority Black or majority white city council, right? Like Washington, DC has had a majority Black city council like for decades now. but there's just sort of like power of like who gets to be there. And then the other thing, you know, Black activists talk about this all the time. They're like, we like parks. We've been asking for parks. Why is it that it's only when when more young white people move in that now you want to make this place beautiful? You know, there's a study that actually looked at gentrification in New York City and health outcomes. And as gentrification occurs, you have greater rates of preterm birth. Part of it is that there are stressors associated um, with when you know, there's sort of the demographic shift. People are calling 911 more often, or 311, whatever. People feel more policed by their new neighbors. And I think one of the things that needs to happen is that, one, policymakers need to listen to Black people more, right? Like activists, community organizers have been making these same demands. In fact, the concept of environmental racism was born out of young Black organizing movements in the rural South, right? It isn't like, it's not a concept born out of academia by white scientists or environmentalists. Although now, if you look, you know, I don't know, Google Scholar, the people who are publishing on it are disproportionately white, but the concept is born out of the demands of Black activists. So listen to the activists more. So when these investments are made, they should be made, you know, with the people in mind. And so there's this other element of real estate, right? So when somewhere starts looking more beautiful, landlords want to make more money. It's more attractive, and so maybe the landlord wants to raise prices, and then the people can't afford it and they get pushed out. So there are laws in place that can be strengthened such that, you know, there's perhaps like a cap on how much you can raise rent on your tenants. For instance, in DC tenant laws are really protective of the tenants, in part because of this. For instance, what a lot of landlords used to do in DC is that they would, you know, they're planning to sell, because, you know, you sell your lot or you sell your building, it gets renovated, you know, just that's how gentrification occurs. But now in DC, you cannot sell your building unless your tenants have had the opportunity to bid on it first. Like, you know, if it's a home, your tenants have first dips on potentially buying the house, so that you know, you don't just easily push them out. But generally, the biggest umbrella of it all, I think, just housing policy is a crux here. And so in the United States and in a lot of capitalistic societies, housing is seen as a way of building wealth, right? And so it's this huge currency where uh, uh, if economic shifts occur, housing is one of the things that changes a lot. But I think there is a fundamental disconnect between our belief that housing is a right, and that housing is a means to wealth. Because in order for, just the rules of capitalism, supply and demand drive the value of a good. And if housing is meant to be this like most absolute valuable good that responds to supply and demand dynamics, you need some kind of mismatch between supply and demand in order for the value of housing to increase, and for people to earn more money from housing and real estate. And so we as a society have to agree or disagree, right? Is housing a right, or is housing not a right? And if it is a right, then perhaps housing shouldn't change. Perhaps then we shouldn't create scarcity based on housing. And if there's no scarcity based on housing, then housing prices don't change with economic shifts. That's a long-winded answer for this issue of gentrification at the local level, but I think it is also globally applicable, because homelessness in this country is a huge issue. And of course, I think over half of the homeless population in the United States is Black. Black people are only 13% of the US population, right? It's huge, huge, huge race issue. Which again, and when we look at the racial wealth gap, 60% or so of the racial wealth gap, or that wealth that has been accumulated by white people in this country, stems from, housing policies from the 1920s, 30s, 40s. So I think that's like a true issue that we need to wrestle with and come to terms, like, is housing a right or is it not? That's the fundamental question that would disrupt this whole conversation.
It's fantastic. I think you've inspired some other comments as that's been coming up. Anna Monica has just written that she's loving your talk because of the difference. She's thinking about the context between Mexico and the US, noting climate change effects even more from the border of factories and the social health system or economic policies, and that poverty here from the impacts and the concessions with international factories for resources. I suppose it goes to access to resources, to land rights, to ownerships, and some disparities and issues. And then there's been a lot of votes on a question from a context of people who are in a semi-desert location and wondering about health, perhaps linked to some of your research on access to green spaces, environmental issues. And the question is, and what to do.
Wait, sorry, do you mind repeating the question?
It's from Andrea, and it said, how about people who are living in a semi-desert location, and what about their health, and what are they supposed to do? I suppose you've been talking about from an urban perspective, but maybe right. Also from other contexts around the world as well.
Yeah, so that's, I'm going to be honest, that's something that I haven't looked, the health contexts are different depending on the setting, right? And obviously, like, your environment predisposes how you respond to your future environment all the way down to the molecular level. So I will be honest here, that is not something that I've particularly studied. Interestingly enough, that's actually a question that I got on my most recent paper, like in the revise and resubmit, when I was like, trees are good for health in urban settings. One of the reviewer asked, how does this work in more arid or desert settings, and I was like, well, it's beyond the scope of my study. But also I think I don't know, like OSCs might be, there might be a corollary in desert setting as to what is protective in terms of health versus not. But I think it's something that's absolutely worth studying. Like I said, where I grew up, Cameroon, right, there's desert up north, and I think the needs of people up there are probably very different from the needs of the people down south in urban settings like where I grew up. So
brilliant, thanks for that. You may have inspired future researchers around the world. I'm going to go to Ariel's question, who's actually asking about financial limitations and wanted to know if you've encountered financial limitations when you want to carry out research that makes the relationship between race and health visible. Maybe is enough being invested into this area?
So I personally, the research that I'm doing this like as a medical student. I happen to be funded by my medical school to conduct research, but of course there are limitations. The grants, grant funding that's available. So for instance, here in the United States, the NIH is a big federal body that funds research there, and it has multiple like institute, right? So the Institute of Health that focuses on health disparities is the least funded of all of the NIH's sub-institutes. Of course, one can study health disparities and seek funding, for instance, from, I don't know, National Child Health and Maternal and Child Health Institute, or from like the Cardiovascular Institute. You could technically apply if you're focusing on, I don't know, diabetes, heart disease, whatever. You could apply for funding from those institutes. But the institute whose mission is to address or study health disparities has the least amount of funding. And there's also evidence that people whose research topic is related to health disparities, social determinants of health, even if it's not necessarily related to racism, are also among the least likely to be funded. And in fact, this was found out by the initial impulse to study why is it that Black scientists are like more than half as likely to be funded for their grants. And as it turns out, Black scientists are more likely to be interested in, for instance, Black scientists in the health context, more likely to be interested in addressing issues related to community health, patient-centered health, health disparities, and those topics are less likely to be funded. And so are women's health. That's another less likely to be funded topic. And also, even then, when you look at, when you look within people who want to study health disparities, white scientists who study racial health disparities are more likely to be funded than Black scientists. So there is indeed a huge issue in terms of federal and even foundation investment in conducting this kind of research.
Thank you, Max Jordan. There's other questions coming up, which some which are coming in the Q&A. There's a very practical question, which from Joshua, which 5 people have highlighted. So ask that, and then also make sure to have time for some concluding remarks and maybe any calls to action that you want to raise. Do you have any comments on which tree species you consider that are best for the urban context and why?
I'm going to be honest, I don't. I mean, I'm more at the thinking about the structural level, and I want to leave the entomologists and the people who know which specific tree species are like better at filtering PM 2.5. So yeah, just.
Just because we're getting close towards the end of time, one more question that's been highlighted with a lot of votes is any thoughts from yourself on research that compares mental health in Black and Hispanic people in contrast to white people and its relationship with higher or lower exposures to pollution?
Yes, there is research on that. Pollution is associated with greater amounts of stress. And it's not. How am I going to say this? Like noise pollution, or is a question related to air pollution only, or can I talk about noise pollution? So noise pollution affects sleep quality a great deal, and people who, of course, there's a that mind-body connection between the quality of sleep and depression and anxiety and even psychosis. So absolutely. And of course, there is an association between noise pollution and air pollution, right? If you live near highways or if you live near train tracks, that of course emit where there's a lot more, noxious gas emissions compared to if you, I don't know, live in the suburbs where there's a lot less traffic. So yes, there is evidence of that.
Brilliant. Thanks, Max Jordan. Would you like to share any concluding remarks? We're getting close to the end of the time. The talk will be available for students to see later on the YouTube channel. And any sort of concluding remarks or a call to action, the action that you'd like to see from students and also from universities around the world as part of the Global Universities Climate Forum?
Yeah, I think just generally, it's really key that we think about how resources ought to be redistributed in favor of, like better environmental, in favor of better access to, these, for instance, parks and green spaces and whatnot. I also, think and incentivizing the creation of green jobs and like corporate level policies that would favor, for instance, repurposing, and I intentionally say repurposing and not recycling, because we know that not all recycling actually works, right? And then I want us to generally think globally in terms of economic policies that ultimately starve lower and middle income countries, because in many different ways, right? Like foreign policy and war that end up really shaping environmental policies in the Middle East and sub-Saharan Africa, for instance. And I am going to use a little bit of an anecdote here. So when I was around 11 years old, growing up in Yaoundé, Cameroon, our national organization for electricity was bought by a U.S. corporation. About 51% of it, not entirely. It's bought by a U.S. corporation, AES, based in Virginia, not far from where I ended up moving to, however many years later. And one of the things that they did was that they really got into austerity in rationing electricity. And so in my neighborhood, and of course it disproportionately affected the poorer neighborhoods, but in my neighborhood, every Wednesday evening, we knew that there would be a power outage as a way to ration power use, you know, in the city. And so I would come home from school on Wednesday. Luckily, Wednesday are half days in the Francophone world for school, and rush, hurry up, do my homework before sunset. Otherwise, I would expect to do my homework with a candle or petroleum lamp for light purposes. And I think it just speaks to the ways in which you know, neoliberalism, you know, enacted by both U.S., you know, U.S., British, you know, you name it, French corporations, really truly affect the daily lives of people in lower and middle income countries. And I think we don't necessarily often think about that. Like, you know, we just vaguely speak about climate change and the planet is in danger, but like the companies whose products we consume, the policies that we vote for or against that end up shaping you know, foreign engagement, really, really shape the lives of people like me. I mean, I'm now here in the US and like I have an iPhone, which like very problematic, but I just want us to be aware of, you know, how the policies that we, you know, we support, engage in, ultimately really shape like the daily lives of people elsewhere, and think about how, you know, that personal is political for others. Yeah. Or that political is personal for others, you know, yeah.
Thank you so much. Max Jordan, on behalf of all of our students who've joined us on this call, I want to give you a very big thank you for taking your time for this inspiring presentation and discussion. And you've got lots of thank yous and applauses coming up on the chat. And for anyone, the students who are here who are looking for this, Melissa sent out the link, it will be available on the YouTube. But wherever you might be dialing in from, wherever in the world, we wish you a wonderful rest of your day.
Thank you so much. Yes, I'm here in New Haven, Connecticut. Feel free to follow me on Twitter. I think I posted my handle there. It's Max Jordan _ and I post quite a bit of thoughts related to racism and also environmental justice. So thank you all for having me and for your attentive audience. Bye.